At times, the implant may not be in the exact location that's ideal, and that's why we coordinate it very well, as best we can here, to make sure that it doesn't occur. If you look at this photograph, you can see that the implant is toward the palate from where the teeth are, and that's because it was done in a way that could have been better. Here's another situation. A young individual came in that had a fractured tooth. So most of the time we can restore teeth, but if there is a fracture in a way that's impossible, then what we have to do is another alternative. So in this case, we took the tooth out, as you can see, and we placed an implant immediately at the same time. And
in one day?
We placed
the implant in one day?
The tooth came out and the implant went in at the same time. We didn't put the final restoration on that day in this case, but it can be done.
Wow.
So here it is, as you see, after it's healed, and at this point we were able to put in the restoration. As you can see, it looks very natural, and the patient was very happy. Here's another one. This patient was wearing a denture like the overdenture one we looked at earlier, but in this case the patient wanted something that was fixed, wouldn't come out. So we, as you can see, we made a CAT scan using a template so that we could see exactly where the bone was, and then from that I made a guide so that the surgeon could place the implants, as you see here, in the locations that we wanted. Then after this point, we were able to, after wearing the denture for a couple of months, we placed a fixed bridge. So this does not come out. Very functional and aesthetic.
It seems like everybody would want something that wasn't removable. Is there a reason why everybody doesn't get that?
Well, of course, everybody would like to have their fixed bridge or their own natural teeth back, but there are certain times when there's limitations.
Okay.
They may not have enough bone. They may need more lip support. Some financial considerations may be involved, but regardless of what we do, they're able to chew. They're happy. Their life has changed regardless of how we do it. Even if it's a snap in or snap out or a fixed bridge, it is very, very secure, and the patient does very well.
So those teeth look natural. That's a denture right there?
This is the denture, but the patient didn't want a denture. They wanted something that was secure and fixed, and they wanted something similar to what they had originally. So we did a CAT scan, found out where the bone was. We coordinated with the surgeon and placed the implants, as you can see in this photograph. And following a couple months, we were able to put in a fixed bridge, much different than the other, but very secure and the same result.
Now, Dr. Nicholas told me that you're changing people's lives. Is that true?
Absolutely. These patients who have been afraid to go to dinner, to be in social environments, now can do it, and they're great.
Now, you used to teach this at USC, is that right?
Yes. Yeah, we had a selective, and actually it was one of the first in the country that taught dental implants to dental students before they graduated.
So how long have you been doing this?
Oh, more than 20 years. Is
there a steep learning curve when it comes to making them look natural? Because these teeth look natural. They look real to me.
Well, the more you do, obviously in anything, the easier it gets. And so initially when the implants were first available, we had very limited ability to make them look really good. They function well, but now over the years we can make them look as good as natural teeth. And even if they don't have the bone, we can give them bone in the area they need it. So we can pretty much go back to where they were initially before they lost the teeth.
So how much of this is an artistic ability versus a technical ability?
Well, actually that's the fun part. So we can make them function well, but to make them happy and see how their smile is transformed and how they can do different things, that's the fun part.
And you said that I guess a lot has changed in the dental field in the last 15 or 20 years, your ability to make natural looking teeth. How has that affected your practice?
Well, a lot of it were technical things that were evolved by the manufacturers, but the nice thing now is that everybody wants to look good. You know, it's California. Everybody wants the Hollywood smile, but we can do that now. Whereas before, the ceramics and the technology, and we're using computers to mill crowns and so forth. It's really easier and makes it really a lot of fun.
And they look really, really great. Do you have more photos? We're about out of time.
I have a couple more. So here's one that a patient you can see that has a flipper. We call it a flipper, or a removable bridge replacing a couple of teeth. And in this case, there's a little trauma involved when the patient lost the teeth, so there's not a lot of bone. We were able to, as you can see with this little device, put the bone back in the location we needed it. And so as you can see here at the final shot, the patient looks very natural again and doesn't have to wear anything removable. Here's another one where the patient was unable to keep the tooth because it fractured. And in this case, we were able to put the implant crown on the same day that the implant was placed. So it was immediately placed. The patient never had to wear anything removable.
That's amazing. So is this cosmetic dentistry?
Well, partially, yeah. Implants can be part of cosmetic dentistry, but we also have other things that we do here that are involved with cosmetic dentistry. As you can see, this patient had some areas that they needed improved in their smile, and you can see what we did with some porcelain veneers. Here's another one, Lori. I think you'll like this. This is really a dramatic change for this individual. You see here, the patient had worn the teeth down over the years and was not functioning well, was afraid to go anywhere, didn't smile. As you can see in the completed picture, that we were able to really make a huge difference in this person's appearance. And not only that, we were able to reestablish his bite, so he could not only look really good, but feel better about himself and chew.
Now, what does that mean exactly, reestablish the bite?
Well, in this situation, the patient had worn their teeth down over the years so that their mouth was collapsed. So it makes their facial features, everything look older and kind of sunken in. And so by bringing the bite back to where it was originally before it was closed, we were able to not only make the teeth work and look better, but make their face look better.
So we're out of time. We came here today, we're talking about dental implants. What's your final message?
Well, I invite anybody that's not happy with their smile or their ability to chew or anything to do with their teeth to come in and let us give them an opportunity to know what's available. It's a coordinated treatment here. We have hygienists, we have the surgeon, we have prosthodontists. We can do a lot of things. We can do everything here.